And let me give you just one example of what we have got to be doing in the immediate future. Earlier this year, the President and I called on Novo Nordisk and Eli Lilly to significantly reduce the price of their blockbuster drugs for diabetes and weight loss.
Bottom line is, you are charging the American people substantially more for the same exact drug than you are charging people in other countries. And my question is, why?
I appreciate the question. Let me try to explain how I see it. We launched Ozempic in 2018. We have had it on the market for some years. During those years, our price has declined by 40%. I mentioned that patients with insurance have access to the $25 or less for 80% of the cases. And if you look in this period in Medicare, where there's broad coverage, premiums have not gone up. In the same period, the insurance companies and their PBMs, the big conglomerate of legal entities they have more than doubled, actually close to tripled their profit. So the fact that we can actually secure that 99% of people with insurance have access, that there's a copay at the pharmacy of $25 or less without premiums going up in Medicare, while profit goes up for the middlemen, I think is a concerning data point.
Well, I would simply say that most Americans would be surprised to learn that insurance rates are not going up. In my state, they're going up by 14%. But once again, you are not answering my question.
These are very, very important drugs being used all over the world. Problem is they're so expensive that many people in this country simply can't afford them. In the President's view and in my view, it is unacceptable for Novo Nordisk to charge Americans with diabetes $969 for Ozempic when that same exact drug can be purchased for just $71 in France and $59 in Germany. It is also unacceptable for this extremely profitable company to charge struggling Americans who are dealing with obesity $1,300 for Wegovy when that same product cost $92 in the UK. As President Biden and I stated in an op-ed that we jointly wrote, quote, if Novo Nordisk and other pharmaceutical companies refuse to substantially lower prescription drug prices in our country and end their greed, we will do everything within our power to end it for them. I join all of you in welcoming President Biden to New Hampshire, where we know that the weather is always like it is today, right? It's always warm and sunny, the leaves are always brilliant. So, President, please come back and visit us soon. In America today, as I think all of you know, despite being the only major country on earth not to guarantee health care to all people as a human right, despite that, we are spending almost twice as much per capita on health care as the people of any other country on earth. We're spending over $13,000 for every man, woman, and child, an unsustainable amount of money. And one of the reasons for that is the outrageously high cost of prescription drugs in this country. And the truth of the matter is that the American people, whether they are Democrats, Republicans, or independents, are sick and tired of paying by far the highest prices in the world for prescription drugs. There is no rational reason why Merck should be charging diabetes patients in America $6,900 for Januvia when that same product can be purchased in Canada for $900 and $200 in France. No rational reason why Johnson & Johnson charges Americans with arthritis $79,000 for Stelara when that same exact product can be purchased for just $16,000 in the United Kingdom. No rational reason why Bristol Myers Squibb charges patients in America $7,100 for Eliquis, when that same exact product can be purchased for just $900 in Canada and $650 in France. I personally, on 2 occasions, have led Americans into Canada, where we purchased, on one occasion, a breast cancer drug, and on another occasion, insulin. And the differential was that in Canada, the cost was 1/10 the price that it was in the United States for the same exact product. Now, the result of that absurd reality is that while the top 10 pharmaceutical companies made over $110 billion in profit last year and paid their CEOs exorbitant compensation packages, 1 out of 4 Americans cannot afford the medicine their doctors prescribe. How insane is that? So what happens is people go to the doctor, they're sick, doctor makes a diagnosis, writes a prescription, people can't afford it. So what happens? They end up in the emergency room, they end up in the hospital, they suffer because they cannot afford the outrageous cost of medicine in this country. That is unacceptable, and together we are going to make that change. In the United States, we must substantially lower the cost of prescription drugs so that all of our people can afford the medicine they need, so that we can lower hospital costs. When you go to the hospital, price is high. One of the reasons is the cost of prescription drugs, so that we can lower our private insurance costs, and so that we can lower out-of-pocket insurance costs as well. In the midst of all of this, let me give you some very good news, and I think you've heard it from other speakers this afternoon. And that is, under the leadership of President Biden and Vice President Harris, we are making significant progress in taking on the greed of the pharmaceutical industry and lowering prescription drug prices in our country. Today, no senior in America is paying over $35 a month for insulin. Beginning next year, no senior in America will pay over $2,000 a year for prescription drugs, no matter how many drugs they need. And Medicare, despite the fierce opposition of Pharma, is for the first time in history negotiating with the drug companies to lower the price of some of the most expensive drugs in America. As a result of these negotiations, guess what? The price of Januvia in America will be cut by 79%. The price of Eliquis in America will be cut by 56%. And the price of Stelara will be cut by 66%. That is real consequential progress, and I want to thank the President and the Vice President for having the courage to be the first administration in the history of this country to stand up to the greed of the pharmaceutical industry and take them on. I'm also proud of the accomplishments of the Senate Committee on Health, Education, Labor, and Pensions, which I chair, and which your Senator Maggie Hassan is doing a great job on as well. And we have been working hard with the Biden administration to bring down the cost of prescription drugs. Earlier this year, the Health Committee launched an investigation into the outrageously high price of inhalers for people with asthma. That's 25 million Americans. And what we learned is that the American people were paying, in many cases, 10 to 70 times more for inhalers than the people in Canada and in Europe. Working with the Biden administration and Lena Khan, the chair of the FTC, I am proud to tell you that the CEOs of 3 major inhaler manufacturers agreed to cap the cost of these inhalers at no more than $35. But despite all that we have accomplished, it is not enough. Much more needs to be done. In his State of the Union address, President Biden called on Congress to pass legislation to cap out-of-pocket prescription drug costs for all Americans at no more than $2,000 a year. For all Americans, and to substantially increase the number of drugs that can be negotiated with the pharmaceutical industry, and I strongly agree with them. Let me be very clear. While we are making some progress, we're negotiating, we're talking to these guys, we're not there yet. So in my view, if Novo Nordisk and Eli Lilly do not do more to substantially reduce the price of these drugs, I believe the administration should take bold action to make these drugs more affordable and more accessible. The outrageously high price of these drugs are forcing hundreds of thousands of Americans today to buy cheaper copycat versions of these drugs that have not been approved as safe and effective by the FDA. In other words, people desperately want the product and they're buying some drugs which may not be safe. This is unprecedented and, in my view, unacceptable. Generic drug companies have told me that if the administration exercises its authority to end the monopoly Novo Nordisk has over Ozempic, they could sell the same FDA-approved drug for less than $100 in the United States. And that is what we should be prepared to do if they are not going to lower their prices. In my view, we have got to move forward aggressively so that the people in the United States are no longer paying more for the same prescription drugs that our friends in Europe, Canada, or Japan. And if we did that, we didn't pay any more, we would cut the cost of prescription drugs in this country by more than 50%. Bottom line, the pharmaceutical industry must stop ripping off the American people. Now, this is a fight that will not be easy. Let me tell you why. Pharmaceutical industry today has over 1,800 well-paid lobbyists on Capitol Hill. Got it? 1,800 for 535 members of Congress. And that includes former leaders of the Democratic and Republican Party. In the last 25 years, pharmaceutical industry has spent over $8.5 billion on lobbying and over $750 million in campaign contributions. Their greed has no end. But in my view, if Congress has the guts to ignore all the lobbyists, to ignore all the campaign contributions, and to finally listen to the American people, whether they're progressive, conservative, or moderate, and do the right thing, we can, in fact, substantially lower prescription drug prices for every American and end up not having to pay, by far, the highest prices in the world for prescription drugs. Let us stand together. Let's take on their greed. Let's lower the cost of drugs in America. Thank you.